Hello everyone, this is Marie here, and today I want to give you an update on my total knee replacement experience. And so I'm just going to get on into the video. I don't like a long introduction, and so I'm just going to get to the point. So I'm just going to go on and get on into it. But before that, disclaimer, remember, I'm not a physician. I can't tell you what to do. You need to go see your doctor and your therapist and all that. And what might work for me may not work for you. And what I experience may not happen to you, okay? You got to remember that most of all. And so, but if you do need to seek medical advice, like I said, see your physician, okay? See your providers. All right, so that's all that. And also, this is about me and my experience and my opinions and my just overall experience. So, anyways, here it goes. All right, so last time I talked to you guys, I think it was around September 11th. I think I hadn't even reached 1 month yet. So, since then, first I progressed a little bit. And my bend was back and forth from 87 to 90, 87 to 90, 80 something to 90. I don't know what it was, 92 something. Anyway, that number, you think it's going to keep going up, but then it could just drop all of a sudden. What I read, that's kind of like how it goes on some people, not everybody. I've gotten so many different people who have told me different things about their experience. Like one man I met, he said, "Oh, I didn't have no trouble bending my knee at all." He said, "I just couldn't straighten my leg." Okay. Well, I'm the opposite. I can straighten my leg. No, it's not zero. It never has been zero in years. And I'm having trouble bending my leg. So that's the problem. And I haven't undergone knee manipulation yet. I don't know if I talked about that in my last video or not, but it's where that they put you to sleep. And they actually, it only takes like 10 or 12 minutes, but it's like an outpatient procedure. Oh yeah, they're going to draw blood. Yeah, they're going to put you to sleep. They're going to put it in a nerve block in your leg and different things. I don't know. I really don't know exactly. They may or may not do those things to you, but that's what I know. And they force it to bend. And then when you're done, you may or may not have pain. I'm getting mixed reviews on that. And then as you exercise it, you're going to have pain. That's what I do know from everybody telling me different things. So far, every one of them said, yeah, you have pain afterward. It's not right after the procedure, though. It's when you go through therapy that day after the procedure. Yeah, you're going to have therapy that day. And no, you're not staying in the hospital. You go home, you come back, you have your therapy. And then the process starts all over again. So, yeah, therapy starts all over again. So here you go. And so, anyway, with that being said, no, I haven't underwent that yet. I hope and pray I don't have to. But I know people also that never had a problem and they just kept exercising their leg, and or they were just already able to bend. I don't know how. Like, I know someone who can cross their legs and sit Indian style, and I know somebody else who gets around pretty good. As far as I know, she don't use a cane. But I mean, I'm not going to mention names here for privacy. And see, they couldn't tell me. Everybody can't tell me everything, and what's happening to me is because I'm different. Everything I do is different. I don't know. It's just how my life is, but that's just how it goes. So anyway, I progressed from, bending a little bit, and I was able to start doing the heel slides on the bed. See, before I couldn't do those at all. And I was just doing the heel slides on the floor. And I was able to do some leg lifts and things like that. So I do the calf raises, or the partial leg raise, where you just lift your foot and bend. And then I do the total leg raises up and down. And then I do the heel slides on the floor and the heel slides on the bed or the table. And then they put me on a machine too. Not too long ago. They started me on a machine about 2 or 3 weeks ago. and it brings your legs up and down, bends them, and gets them warmed up before they do anything else. And so, a week or so ago, last week, I was bending at 105. Today, I was bending less than 80. By the time she got done, I was bending at 80 something. And she goes, I don't like that number. So, I don't know. I'm doing some exercises now. Am I doing exercises every single time? I'm not going to lie. No, I'm not, because I have life, I take care of someone who's handicapped, or help take care of someone who's handicapped, but they can do a lot on their own. And also, I have somebody else that I have to help, and they're also handicapped, but I don't help them all the time. And also, I've had a lot of doctor's visits, and also, falls happening, and, there's things you'd like to do, like decorate, or at least do your chores. I'm finding it hard to do chores. Now, I do my chores. I do them. Does it take me a while? Yes, it does. But ever since last week, even though my leg is not bending as good as it was, which I know it can get to 105. If they did it a week ago, I know it can happen again. But I know my leg was tight today. And they've also been doing that KT rock tape on my legs and doing a lymphedema massage. That does help. And yes, it's got out a lot of the swelling. No, I don't have staples anymore. I don't have the steri-strips anymore. The incision actually looks really good right now. If I could kind of show you. Now, I'm going to switch the camera around a little bit. But maybe you can see it partially. But it's looking pretty good. But overlook my house anyway, or my apartment. So anyway, that's that. But there are some things that, too, was not told to me again. Okay, so like yesterday I went for my 6 weeks follow-up x-rays. Well, I didn't know they did x-rays at 6 weeks. Okay, so, but they kept telling me, yeah, you gotta have x-rays, which, okay, that was like after my second or third week. They finally told me, yeah, you gotta have some more x-rays. I'm like, okay. I guess because they gotta check to see if everything's okay since I've had therapy. Yeah, things can happen during therapy. Yeah, or at home, or anytime. So they got to keep a check on it, make sure the hardware is okay too. And so yesterday she goes, oh, everything's good. You can go home. I'll see you in 6 weeks. I said, but wait a minute, I got some questions. But she proceeded to tell me that I couldn't work right now, and that they reevaluate you 3 months out after your surgery date. So I had surgery August the 14th, September 14th, October 14th, November 14th. Then she said they will reevaluate me. And then if you still can't do work or things haven't improved, then they reevaluate you another 4 weeks thereafter and continuing on every 4 weeks thereafter. So this is not over at all. So if you need to take off from work to do this, you better expect to be off more than 12 weeks. You will need an extended FMLA. I'm not saying everybody will. I'm saying that's what happened to me. And I had to give up my full-time job because of the nature of my job. I couldn't do what I have been trained to do. I can't. I'm not physically able. Like, I just now today they said I could go without my walker, or they said I could use it if I didn't feel safe. But they said I could now use my cane outside, because I was using my walker indoors then and everywhere, and then and outdoors. And then they said, oh, you can use your walker when you go outside, but use your cane indoors. So the last about 2 weeks or so, I've been using my cane indoor and using my walker at night because I'm, kind of drowsy. and they didn't want me to fall. And plus, I've had some other issues like my shoulder and stuff. And then they said, yeah, you need to use your walker when you go out. So that's what I was doing until this week. Today, this other therapist took over again, and she said, you can go without your walker if you need it to feel safe. You can, use it, but she said you need to start using your cane when you go outside now. So, but I'm not going to lie, I have been walking without my cane indoor. Because I asked her that, I said, can I walk without my cane indoor? She goes, yeah, but, make sure you have something, nearby or, for stability and for safety if needed. I mean, I haven't gotten rid of that stuff. I still have it. And I'm using it. But for a long time now, probably more than 3 or 4 weeks, I've actually walked around, but occasionally I would hang on to furniture. And there was one incident when I was in my hallway and I thought my leg was going to give out. So then I really did need either my walker or my cane, and I chose the walker at that time. So if they say don't go without your walker, don't go without it. Or if they say you need to use, your cane, use it. It's there for a reason, there's a reason behind it. But, if you don't feel safe or something, you need to get help or you need the right equipment or whatever, and now that they're telling me I need to start getting up without holding on to anything. Well, if I was in a straight back chair or table that they have at therapy, yeah, that would be easy for me to do. But what I have is not allowing me to do that. And since my leg is not bending as much as it did the week before, of course, makes it even harder. But they want me to build up strength in the knees. I get it. They don't want me to use my hands because it's weakened. It's hurting my upper body, and they want me to strengthen my knees. So, and the exercises that they give you, there is a reason for it. It may work one muscle or another muscle or a combination of muscles, or it may work one area like the lower knee or the upper part of the knee or the upper thigh and knee. They're there for a reason. So, but I have been doing the exercises for the most part, not every time, but for the most part. And of course, lots of prayers. I've had that. And like I said, I am doing chores. I am driving now. That's another thing. She told me if I could push the gas, and I wasn't on pain medicine, or especially narcotic pain medicines, opioids, whatever. Anything that'll make you sleepy, then yeah, you could drive again. So I have been driving now for about a week and a half or so. Yeah, I'm not on certain medications. Today I felt some pain, so should I have had something? Probably so, but right now, no. I'm not on that. But like I said, if you're feeling pain, you need to let somebody know and get some help and talk to your provider. Um, and At any time right now, if I keep on regressing backwards, which I hope and pray not, but if I regress backwards, I know for sure I'll have to have that knee manipulation done under anesthesia. And some people have it 2 or 3 times done. And then after that, it's like, well, we can't, I guess they can't do anything else for them. I don't know. But you only have a certain time frame for it to bend before the scar tissue makes it impossible. It will grow and it will prevent it from bending. So that's why you only have a certain time frame to get it to bend to where they want it to bend more. And everybody may not reach the total number that you're supposed to be. I'm finding that out. And I told my doctor about last week the way it was because I hadn't seen my therapist for today yet. And she goes, oh, well, that's great. And she told me that was great. I'm thinking, are you sure about that? So now I'm hearing different stories that now it's got to be above 130. I don't know. All I know is try your best, get it to the bend the best that you can. That's all I know. And that's what I'm gonna do. But like I said, if you feel pain, don't push it further than it will go. Don't hurt yourself. You know. But that's all I can say. All I can say is follow your orders from your therapist and your doctor. If they give you certain exercises, if they tell you what to do, where to sit, how to sit, and, if you can drive, if you can't drive, I can't tell you those things. But I will tell you this is a long road. And some people can tolerate pain better than other people too. But so far I'm doing fairly well. I think I'm doing fairly well. And I know everybody says, "Oh, well, your color looks a lot better than it did." So I really appreciate that. But, that's about it. Walking, driving, no staples, no Steri-Strips. Oh, I can get in and out of a shower now. A tub that has a seat, which I've not had to use a seat yet. But I have a seat for safety if needed. But I can get in and out of the shower now. Can't take bathtub baths, but I can get in and out of the shower without help. I can get in there because we have grab bars anyways in ours. So, and it doesn't have a door on it. It's just a curtain that you can slide back and forth and knock out of your way or put it somewhere out of your way. Whatever you need to do to get in there. What else? Sleep. My sleep is not that great. Health. Other health, like am I eating? Am I drinking? I could do better with drinking water. We all could, I'm sure. Yeah, I'm eating. Yeah, I'm fixing meals. Not big elaborate meals, but I'm fixing meals. Like today, we had salmon with over asparagus and a baked sweet potato. All I did was use a toaster oven and a microwave. That's all I used. So make it simple for yourself as you can. If you have help, that's great. That's fantastic. I'm so happy for you if you do. Like I said, it's just me and my son here, and other than that, that's it. I have people who check on me from time to time, call me up, and then I keep everybody informed anyway. So, like doing videos like this, and then I share it. So whatever. But any other questions you have, you just let me know. I'm just trying to be straightforward and honest with you of what's happening with me. Because like I said, there was so many things that was not discussed with me, and I want to be open to you guys about it all. Yeah. So, oh, and if you need to get a disability parking placard, even if it's a temporary one, I want to give you some advice, and you can check on it. Can't say that it'll work for you. But I found out that if you have to have papers notarized, that a public library, if you live within that area, may do it for free. So keep that in mind if you need that done. But you got to follow the instructions on the form. And don't sign the form yet until it's notarized. So if there's an area to sign, do not sign it and do not date it until you get it notarized. I do know that, so I'm passing that on to you in case you need to know. So the way my form was, I had to fill out the top part, but not sign it, not date it. And then I had to get my provider to sign and date, and then I take it to a notary. So that's what the plan is, and that's how it goes. That's all I know to tell you right now. Just that I am progressing, but yet I'm regressing. I don't get it either. I don't know, but And today my leg is not as swollen as what it has been. So that's why I don't understand, why did I not progress? And last week I was swollen and I progressed. See, it makes no sense to me, but okay, I will take that back about medication. Yeah, I do take muscle relaxers, not every night. But I don't take them and drive. Uh, Not currently. I don't. Um, that's it. That's all I'm going to tell you. But uh, I guess I'll end this video here. I think it's a good ending. And all I can say is just keep going and try your hardest and do your best and do the best that you can. But do it safely. Do everything safely. That's another thing I can tell you, is do it safely. But do what they tell you to do. If they say move to the point to start to feel a little bit of pain and hold it and then release, and then each time try to increase that, that may be something that they might tell you. If they tell you that, you know, just do what you can. You know that when you do exercise, you're going to have to bend it a little bit more each time. Um, but over time, it's not like, oh, I can't bend it this week, but I'm going to bend it by next week or next Monday. I'm going to have it bent by, well, it's going to bend all the way or whatever. I'm sorry, I don't know what to tell you about that. All I can say is that did not work for me, and this is a long process. Again, it's a process. It's a process, and I can't tell you how long it's going to be because I don't know. So that's another thing. I don't know how long, and I hope you do well, and I do wish you well. And like I said, stay safe and talk to your providers and just do what they tell you. And that's all I can say. Anyway, thank you for watching this video. Please subscribe, like, share, comment down below. If you're on Facebook, on YouTube, I don't think you can comment. If you're watching on Roku and you're watching YouTube, I don't think you can comment. But if you're watching from a laptop or tablet or phone or a computer, then you can comment down below. Also, hit the little notification bell so that you'll be notified of all of my upcoming videos. And I thank you so much for watching this video. And bye-bye. Be blessed.